Your belly fat's hurting your heart, ladies. I got to tell you some stuff. I'm not a big person to care about BMI. I never tell my patients to lose weight. I never think a person's weight is the reason that they are injured, because honestly, it's usually not. Usually their weight comes on because it's a sign of inflammation and something else is happening. So instead of saying somebody's fat, in my mind, I think they're inflamed. And this is not like a toxic positivity. This is just that I have talked to enough women to know that many women that are overweight are actually not eating that much, and there is a host of things wrong with a variety of hormones and massive inflammation. But instead of the BMI, one thing that can be helpful to help us understand our risk of cardiovascular disease for women and metabolic issues is our waist to hip ratio. A waist to hip ratio greater than 0.85 is indicative of not good things for your heart. You see, that's what they're talking about with visceral fat. Visceral fat is metabolically active and is very different than the normal subcutaneous fat that you hate with cellulite. For women, cardiovascular disease is the number one killer of us. So caring about the fat in our belly, because that fat, that visceral fat, is going to harm our hearts, is something worth talking about. But there are some things that you can do to help that visceral fat that's not what you think. Trying to manage your cortisol, that's one. So yoga, breathing, walking, getting into nature. Notice I didn't say high intensity impact training and starving yourself. Number 2, eating avocado. Healthy fats actually help you get rid of belly fat. And in fact, in a study recently, avocado was the only parameter they changed in women, and women lost a statistically significant amount of visceral fat. So eating avocado daily is helpful. And increasing your fiber. You literally can't go wrong increasing your fiber. You need no less than 25 grams a day, because this fiber helps with a gazillion things. Your gut microbiome, how you process glucose. It actually matters because sometimes your belly fat, visceral fat, is insulin resistance, and your fiber helps you all those things. So notice I didn't say starve yourself, exercise like you hate yourself, and cut out fat. No, quite the opposite. So if you have a waist to hip ratio greater than what you should, your risk for heart disease is twofold increased. So how do you measure that? Well, you get a tape measure. You measure your waist. Then you measure your hips. Then you divide that. And if your ratio is higher, that's no bueno. So do you know what your waist to hip ratio is?